Hello everyone, my name is Dr. Mohammed Naseer. I am a consultant medical and haemato-oncologist in HCG Hospital, Bangalore. The common symptoms which we see in blood cancer are generally because of increased number of abnormal cells which circulate in the body. Like I told you before, the blood cancer cell usually develops initially in the bone marrow, which is in the center of the larger bones. Here, since the abnormal cells are more, the normal cells become very less. So we have less number of hemoglobin producing normal cells, less number of WBC producing normal cells, and less number of platelet producing normal cells. So we have something called as anemia, leukopenia, which is less number of WBCs, and thrombocytopenia, which is very less number of platelets. So with anemia, generally the patient presents with generalized weakness and unusual pallor. In children, mother usually complains saying that my child has become more fairer and has become more weak. So that is the typical presentation of severe pallor in children. And in thrombocytopenia, generally platelets are responsible for maintaining the normal coagulation control or bleeding control in the body. So generally the patient usually presents with bleeding, or they present with small lesions on the skin, reddish lesions in the skin. Sometimes they present with stools which are passed along with admixed with blood. So generally they present with these kind of symptoms. And when the abnormal blood cells go and deposit in other organs of the body, for example, when they go and they deposit in the bone, more in the center part of the bone, if they go and deposit in the liver and kidney, if they go and deposit in the lymph organs of the body called as lymph nodes, we develop something called as lymphadenopathy, which is enlargement of the lymph nodes. We generally see it in the neck region, we generally see it in the axillary or in the armpit region, or sometimes we also see in the groin region. And enlargement of the liver and spleen, something happens called as hepatomegaly, which is enlargement of the liver, and splenomegaly, enlargement of the spleen. So the patient usually presents with abdominal distension or bulging of the abdomen. Child usually presents with bulging of the abdomen. So these are some of the common presenting symptoms in the blood cancer.